We are Queenship women. Live your best quality of life. Hello, good evening everyone. I am Pamela and I am one half of Queenship Women, and I'm walking in my best quality of life. And I'm coming today to talk with each and every one of you about a topic that's kind of dear to my heart and it's very close to me. It is also a topic that's a clinical issue, and sometimes it comes up in therapy, but not often. And so I want to talk with you all today about a form of obsessive compulsive disorder called excoriation disorder. And so I know that's a big old term and everything, so let me just explain what excoriation, or another word for excoriation, actually is. Excoriation disorder also can be used interchangeably with the term skin picking disorder. Skin picking disorder. I know, guys, it doesn't sound that pleasing, but it's an actual form of obsessive compulsive disorder. So with obsessions and compulsions, let me just say this. It means that the individual is super focused or hyper focused on some particular object or thing or thought that they continuously have. So for an example, the person in this case with excoriation disorder is constantly thinking about some aspect of their skin. It could be any part of the body that they're focused on. More often than not, it's likely to be the face, their face, or maybe their neck area, their chest, just some part of their body that they're super focused on, and they're constantly having thoughts about the appearance of their face, what it looks like, and it's very difficult for them. So oftentimes, for example, if this individual gets any type of blemish, any type of acne, they're more likely to pick it. And you've probably heard of this when you were, a kid growing up and you got a pimple or a zit or something on your face, and your parents may say, or particularly your mother, oh, let me bust that. Or, if it's a white head, a black head, or, whatever bump, oh, let me put something on it, because everybody wants to get rid of the bump. Everybody wants to get rid of the zit. And so what happens with a person with this disorder is that they're used to putting their hands in their face to get rid of the bump, to get rid of the zit. At the same time, I'm sure a lot of people growing up was told, do not touch your face, your fingers are dirty, which they are, because we touch everything. And so we're constantly coming in contact with something that could have germs on it. The doorknob, the tables, anything, you're putting things in your mouth. So yes, our hands do carry a lot of germs. Unfortunately for the skin picker, they're not always thinking about that. They may, to a certain degree, when it comes to entering and exiting out of bathrooms and things of that nature. They're definitely not putting their hands in their mouth afterwards. That's not what I'm talking about. It's not a hygienic issue necessarily, but it is, the constant desire to make sure that their face is clear, that their face is okay, and so, or their body part that they're picking, which could be arms, legs, or anything. And so I want to talk about this because this is something that I have struggled with my entire life. I was that child that, when puberty hit, the acne came with it kind of hard. And so I've always kind of dealt with that. I've been to dermatologists. I've tried all types of topical creams and medications orally and everything, skincare products, Mary Kay, what have you, makeup, everything to try to improve the appearance of my skin, particularly my face, because that's the first thing that you see when someone looks at you is your face. And so most people definitely want their face to be nice. I've tried, different things such as pulling hair from my face so that I don't get the acne, etc., cleansing my skin more often. But I do produce like oily skin, and in some areas it's dry. So, I mean, I also kind of suffer from eczema from time to time, especially during the winter months. So, with that being said, I tend to have bigger pores on my face, so that can also be easy access for for dirt and germs to get in my face. So I'm saying all that to say over time as I got older in my family, particularly the females on the maternal side of my family, oh my goodness, guys, we all kind of suffer from this. I call it the curse of, some facial hair and stuff. Some, people, especially people that have, any type of weight issues can oftentimes suffer from, excessive facial hair. And what started off with sideburns, and then I picked with those over time, and then those, became, increased in, over time I just started getting more of them. And then they too produce blemishes. They do produce, acne. And so I purposefully did not wear any makeup because I knew I was doing this video today. And so as you can see, there's some different like dark spots on my skin, especially right here and then on my chin area. If you can see, there's some different spots and stuff from different blemishes, as well as some trapped ingrown hairs. And I am a tweezer queen. Most of the women in my family are, and so we're constantly trying to remove any ingrown hair that may come because I just don't like the feel of it. When I rub my hand across my face, I desire to feel smoothness, everywhere. I desire to feel for my skin to be smooth. And, unfortunately, that has not been something that I've had, throughout the course of my life. One would think you'd be used to it by now. But, for whatever reason now, I realized in recent years that I am more focused on this issue than I need to be. And that's why I'm sharing it with you all, because I'm first identifying what the issue is. You may have heard of dermatitis. It's another word or term that can be used interchangeably with excoriation disorder. So I have these different blemishes, and so now noticing that they're there and I cannot stand the feel of them, I cannot stand the feel of any type of facial hair that may be there. I just have, and it goes back to our beliefs. I've always had the belief that men have facial hair and women do not have any facial hair whatsoever and not even underneath their armpits. So I shave, I make sure that I don't really like that. And that may go back to when I was a little girl. My father had a full beard from cheek to cheek. He would grow his beard out when we were little, and it would be hard to give him a kiss on the cheek because he had all this facial hair, and I never really liked the way it felt on my face. And so I don't know if that's where it began. I try to go back in my mind to say, there are other forms of things that I have obsessions about or compulsions about as well. But I'll save that for some other time. But for the sake of this, that may have been when it began. I used to remember as a little girl going to, with one of my relatives oftentimes to the electrolysis, and they would get this electrolysis to pull out these hairs in their face. And also when I was a little girl, some of the women in my family would say, Pamela, I would like for you to tweeze the hair out of my face and this part or that little part over here. And I guess over time I just grew used to doing it, and it became a habit, and they would tell me, when you get older, you're going to have this issue too, so get used to it. And so I was like, oh my goodness, I hope I don't have this issue too. But unfortunately, DNA is what it is, and I developed the issue as well. And it doesn't make me less than a woman. It doesn't make you all less than a woman. I mean, I still have lady body parts. I produced 2 kids, gave birth to 2 kids, and my body did everything it was supposed to do. So without being too graphic, I am a woman inside and out. Trust. But, with that being said, you know, I always had to struggle with that belief that men have facial hair. And so whenever I would see it, you know, I would want to get rid of it. I would want to get rid of it. And I would do, you know, I tried, you know, going to get it waxed. I've even done laser hair removal, you know, on my sideburns. And it did help for a little while, but, you know, let's be clear, it was rather expensive. The tweezers are not expensive, but they do produce the worst result as far as facial scarring goes. And so that's what you see, these facial scars. And oftentimes, you know, when I did the research on excoriation disorder, because the DSM-5, which is the Diagnostical Statistical Manual in which clinicians utilize to diagnose other people, well, licensed clinicians use to diagnose other people, when I look in there, they don't really give you in the DSM-5. They tell you what it is, what the disorder is, and the criteria for it, and it gives you some understanding of how a person may have you know, gotten the disorder, etc., and some statistics stuff on that, but it doesn't go into treatment of it. And so when I was researching this disorder, some of the treatment options I found, and it was very basic stuff, guys, outside of the normal go to the dermatologist, try some preventative measures such as exercising and losing weight so you won't produce some of the facial hair that may cause the skin picking, at least in my case. But as it pertains to skin in general, you know, some preventative measures that I found, which I thought were, okay, it's not too many options out there, other than, of course, going to therapy and, you know, really, you know, seeing a clinician about your obsessive compulsions. Your obsessions, again, are thoughts that you're having, that you're constantly super focused on one particular thing, an object, or something. You know, you're just super focused on something, and you're having racing thoughts and repetitive thoughts about it. The compulsions is the act of doing the behavior over and over again, and oftentimes it comes from the obsessive thoughts. So if I'm thinking about, you know, my face all the time, and I'm thinking about the facial hair, and I'm thinking about the acne that is on my face, then the behavior is the constant tweezing. That's the compulsion. Gotta constantly do this, you know, multiple times during the week, sometimes multiple times during the day, depending on what it is. Because it just seems like no matter how often you may do it, it seems like there's always some that's missed, or they come in later. I'm like, gosh, how fast does hair really grow? You know, so it really does grow fast. So bottom line is, you know, this is a constant process, and it's frustrating. With excoriation disorder, we're starting to talk about the treatment of it. It's so important to see a clinician to help you work through those obsessive compulsive thoughts and behaviors, okay, to gain some type of interventions and ways to control it clinically. You can go to the dermatologist, you can go to your physician, also for some additional supports. But something that you can do on your own, all by yourself, is making sure. One of the things that was helpful for me is I started letting my family and friends know that I had this particular issue. So I'll say, hey guys, if you see me touching my face, or if you see me tweezing, alert me, give me a signal, you know, a timeout signal, or, you know, or say hey, or a word, some signal that lets me know, oh, you're doing it again. Because oftentimes a person who does this is not even cognizant. They're not even aware that they're doing it. They're, you know, sometimes when I feel anxious, I'll do it, and I don't even realize that I'm doing it. You know, it's a coping mechanism, but someone will alert me, and then automatically my hand stops, and I'll stop doing it. Something else that you can do, another thing that works for me, is to covering up that skin that you don't want to pick. So if that means if it's your arms or your legs or something, you may want to unfortunately invest in some, you know, wearing some longer sleeve blouses or jackets, or pants. I know in the summertime when it's really hot, that can be difficult, but something that's comfortable. You know, it doesn't have to be really thick, but a thin layer of something to cover up. With makeup, I already feel that my face is overloaded with oils and things on it, so I don't want to touch my face. I don't want that makeup to smear or get on my hands and then get on my clothes, but it does really help with covering up the blemishes as well, so it's already packed on there, good on my face. I don't want to touch it. I don't want to mess with it. Okay. So another type of intervention you can do on your own is, sometimes people say, and this is a bit much, but you could, wear little band-aids or something on your fingertips so you don't get the feel of that skin that you're touching. You won't get to pick it. Wrap it up. But that's a bit extreme. Nobody really wants to walk around with bandages or band-aids on their fingers. But if you're sitting around your house in the evening and you're away from people, that may be a good intervention for you. Some people, wear little lace gloves or mittens or gloves in general, latex gloves if you're at home, for example, for guys that may have this disorder. So again, you're not touching, you're creating a barrier on your fingertips so you won't get the sensation of touching your face. That is what this is to serve as a way to block the sensation from touching your skin. Okay, some people may sit and they may hold their hands in their pockets. They may sit on their hands until they're able to block it. It's different things that people may, it's just being creative with different things to prevent yourself from touching your skin. And so, I just want to share that with you because it's no right or wrong way. It's just what's going to break that habit, what's going to break that habit. So I'm sharing this with you all because, this is one of those situations where I continue to battle. It has not reached a point of complete clinical distress for me like it does for some people. Like as you see today, I went the whole day without wearing makeup. I didn't just wear it for this video. There are days when I just don't feel like wearing makeup, and it doesn't matter where I go. I could be at church, I could be at an event, and I just don't want to wear makeup. There's months when I don't want to wear it, especially in the summertime when it's really hot and my face tends to sweat. I don't really like the feel of the makeup getting on my clothes or anything like that. And so one will say, well, do I really have the disorder? Probably not documented really, because it's not that severe in me. I still can, walk around, move around, etc. However, I will admit that it does, make me feel insecure sometimes. If I'm not feeling my best, if I'm not as confident as I normally am, I may, for whatever reason, I may not want to show it. I may cover it up. Or if I'm noticing I'm picking too often, and I will cover it up because I want to deter myself from doing that. So these are just some things that I'm sharing with you all. But for some people, it really is a disturbance. They don't want anyone to see their skin. It keeps them from social events. It keeps them from socializing. They suffer from low self-esteem. They don't want to look anybody in the eye because of it. And so they think, they don't feel high about themselves at all. They put themselves down. They think they're unattractive or ugly. And so, those are the people that are suffering with, anxiety and depression. And they're maybe isolating themselves from other people. And so for those of you who are out there, I just want to say this to you. You are not in this alone. You are not alone. There are a lot of other people out here that are suffering from the same issue. And I just want to say to you, most people that you're interacting with, they're not thinking that about you at all. They think that you're beautiful. They want to be in your company. They're not concerned about, your skin as you may think that they are. So a lot of times it's what's going on in our heads about ourselves, and we can be our own worst critics at times. Let's be clear. So I'm just saying this to you. I had this on my heart and I wanted to share with you all. If you're really suffering from this, please go seek treatment. It is a diagnosis. It can be treated. A clinician can see you for it. A clinician that specializes in obsessive compulsive disorders would be the best kind of licensed therapist to see. There are some videos that you can look up on YouTube, about this. You can do your own research, and you can do by trial and error of what works for you. What will help you to feel, better in trying to control for this issue. So that is just my discussion today. I hope you learned something today that may be a blessing to you or someone else you know. So please, please, guys, please share this information to others. It's not something that is commonly talked about. You know, you may bring it up in there and someone may be surprised that you even brought it up and you know, and be open enough to talk with you about it. That is the hope. So visit us at Queenship Women, our YouTube channel, Queenship Women. Me and my sister Natasha, we'd love to hear from you. You can email us directly at queenshipwomen@gmail.com. And so please let us know what you think about this. You know, subscribe to our channel. We'll have a variety of other topics affecting our people, you know, affecting, you know, people on a day-to-day basis, some things you may not even be aware of. So we look forward to speaking with you, hearing from you, and hope you have a wonderful rest of your day. Goodbye.